really, this is the beauty of the whole thing. We can read the body. Remember, I did not ask Anya, what are your symptoms? Because that would influence me. If a patient comes in and says, oh, I'm feeling sick and I get pains down here, immediately I'm thinking appendix. And it may not be appendix. So I would prefer to know nothing and read what the body is telling me. Then I can find where the cause is. So, master the control measurement point, master the optimum setting, that's like gold.
Yeah.
And then you know it will be very easy after that. Very easy.
It may also...
There are only 3 areas. In Dr. Fall's day, the most common focal problem were dental problems. But since the 1950s and 60s, dentistry has improved so much that we don't often see so many dental problems. Occasionally a problem, yes. There is never a 100% answer. I find usually the most common problem is the tonsils, followed by the sinuses. They're not the only areas where a focus occurs. Gallbladder, appendix, and prostate or ovaries are also possible focal areas, but they're far, far less common.
Focal areas are generally treated locally, with local points, like the other focal
Well, you're making life difficult for me.
Maybe too early to...
Ideally, we also need to master 5 elements as well, not only EAV, because, and you know, it's all right, don't worry about the necklace. Yes.
Same.
The beauty of the optimum setting is it is good for any point on the body for this person. The problem is, tomorrow it might be a different optimum setting. It won't stay the same. You can check a pulse if you wish, but you will be.
Yeah.
Upper yin that was bad. 54. Still a little bit out, but only 55. 50.
Yeah.
The young meridians weren't too bad, although triple warmer was a little bit high. 50. 52. 50. So much better balance. Later, let's get the basics first. Don't try to do advanced work until you can do the simple work.
No, actually without needles, using only MORA, right? And it's sometimes much more effective. But sometimes, as Tony many years ago told us, sometimes he needs needles, even though he uses MORA mostly, right?
Realize we can do everything with just the machine without penetrating the body. We can do anything. We can treat so many different disorders in the body. Remember what I said, nature does the healing. Your job is to rebalance the body. And it will do it better than drugs, but if you start to publish this and make big articles about it, you're drawing the attention, especially of the pharmaceutical companies, and sooner or later they will do to this what they did to homeopathy, try and destroy it. So it's a very difficult balancing act. You want people to know about the possibilities, but at the same time you don't want to be persecuted. And it will be countries like China, like Taiwan, like Russia, where the pharmaceutical companies haven't got so much influence, that will lead the way politically. In Europe, it's very, very difficult. I never say to the patient, I'm going to make a diagnosis.
Right.
I'm making an assessment of the energy in the meridians. and I'm never giving treatment. I'm rebalancing the meridians. It's purely language, but it avoids the difficulty of diagnosing.
Yes, of course we, there's a caution we, supply to our customers. Never say you have a patient, you have a client.
Yes.
You do the assessment and some of that stuff, but then people tend to, all right, if it's assessment, what is assessment for the God's sake? I would like to know what's wrong with me, right? Parasites, fantastic, right? So that's, you see, and we have to find a way to help customers, because we should not live in the illusion that the doctors, like professionals who should be interested in this, in helping people, right? They would never come to this type of therapy because they are so happy in the situation they live now, with no responsibility whatsoever, because it's like, corporation, and the corporation keeps itself to itself and protects from the outside world. So why they should play around with this stuff?
But there are many, many people who get dissatisfied with clinical medicine. I call my practice the trash can, because people come to me when everything else has failed and expect us to put it right. But I give that caution of use of language, and there's one final question I think we have to ask today. Do you want to go further, or do you want to stop here? Do you want to have another seminar at some point in the future?
Yes, absolutely. Maybe we could do it next month.
No, because you are not finished with my discussion.
I'm quite happy to come here and help.
Another question, sorry.
And also, please remember one thing. I am not always correct. You have to decide for yourselves, because you will all work differently. There is no absolute correct way of doing things.
Yes, but the basics are there, and we should start with basics. Foundation.
In the 1980s, I saw many, many low measurements. It was common. Today, and I don't think my technique has changed, I don't see these low measurements, and it worries me. And I think the reason is all the pollution in food, pollution in water, pollution in air, and above all, electromagnetic pollution. It's stressing our bodies, and the readings are consequently getting higher and higher.
My question, is it possible that we can get, I don't know how many things you can read, but in the experience you see, you have measured the control points and you know directly, okay, it might be this direction. Is it possible that we can get pattern for a different direction where?
It is, but it's difficult, because we can teach technique, that's not a problem. What I cannot teach is experience. That is something you have to build up. And there is one thought that has just occurred to me concerning allergies. Allergies, of course, are important, but most allergies are not allergies, they are sensitivities. And a sensitivity will cause a high measurement on the allergy vessel points. A true allergy is a low measurement, less than 50. And with the sensitivities, what will happen, let's assume a patient comes in and you find, oh, you're allergic to apples. You treat, you desensitize, and a month or 6 weeks later they come back, apples are clear, but oranges are now a problem. So you do the same again, and 6 weeks later they come back and they're lovely. They can have apples, they can have oranges, but now bananas are a problem. And this keeps going on month after month. And what it is telling us is the allergy or the sensitivity is not the cause. Almost always it's a focal problem in the sinuses, the teeth and the tonsils, one of them. solve the focus first, and most sensitivities just disappear. The true allergies don't disappear. So that's all I have to say for today. Thank you.